Hello, guys. Welcome to Labor Room podcast on checkdoctor.com. And this is Dr. O speaking live from the studio, obviously. Yeah. So today we're actually discussing preterm labor. Yeah, preterm labor. What is preterm labor? Okay. In simple terms, this is when you go into labor before you are at term. So I think we are going into labor before 37 weeks, like I said before. In more explanatory terms, it's like regular contractions leading to cervical dilatation. That's regular contractions leading to the opening of your cervix before 37 weeks. Okay. And how do you know when you are going into preterm labor, or what can cause you to have preterm labor? Okay, some of the causes of preterm labor is preterm rupture of membranes. So if your membranes or your water breaks before time, then you can go into preterm labor. Or cervical insufficiency. What does this mean? This is when your cervix is getting wider and wider and opening, and there is no without contractions and everything. That can also cause you to go into preterm labor. What are the things that can cause your cervix to open without contractions, rupture of membranes and all that? What are the things that can cause that? Number one thing that can cause it is infections. This is why we always say it's very important to detect infections on time so that it can be treated and they don't cause things like complications like preterm labor. Like I said in my previous podcast, infections, especially sexually transmitted infections, some of them can actually lead to preterm labor. Another thing can be problems with the placenta, such as placental abruption, like I've spoken about before in my previous podcast. This is when the placenta is tearing away from the wall of the womb. Or placenta previa, like I've spoken about in a previous podcast as well, when the placenta presents before the baby, so it can actually block the birth canal. It can either be partial or fully blocking the entrance of the uterus. Okay, another thing that can cause it is when your womb is too large. This is usually seen in women that are carrying twins. Their uterus has expanded, their womb has expanded so much that it becomes so big. Or women that have something that we call polyhydramnios, where the fluid surrounding your baby, the amniotic fluid, is excessive. It's so much, it now makes your womb big. So this can put you at risk of preterm labor. Another thing that can cause you to have preterm labor is abnormalities in the uterus or the cervix. So for example, if you have an abnormally short cervix, it can easily cause you to go into preterm labor. So all these things are causes that you may or may not be able to prevent. For example, the infection one can be prevented by practicing safe sex, by detecting any abnormal changes on time so that they can be treated immediately. But things like large womb as a result of carrying multiple twins, there's not much you can do about that. But like I said, try to be more observant so that if there's any complication that is happening as a result of this, you can report it to your doctor and it can be detected on time. So now to the jam question. How can I identify when I'm having preterm labor? How do I know when I'm going into preterm labor? What would I see? What would I observe? What are the changes I would notice? First one is an increase or change in your vaginal discharge. So for example, I think I mentioned it in previous podcast as well. If you notice that vaginal discharge becomes more mucus-like, it looks more like egg white, it's thinner, and sometimes it might have a blood tinge. That might be what we call show, and it might be a sign that you're going into labor when you're passing show. Usually, you shouldn't pass this show before you reach term. Term is usually from 37 weeks. But when you're having it before 37 weeks, then it should cause you to be a bit worried because it means that you are going into labor. So if you observe this on your pant or anything, you should report it to your doctor immediately. Another sign or symptom might be if you are leaking watery fluid. So when you notice that every time you go to the toilet, that genital area is wet, there's increased wetness there, you notice that this fluid is watery and you're wondering, what is this? Is it discharge or is it water, or what exactly is this? Most times that might be a sign that your membranes have been ruptured and the amniotic fluid that is surrounding your baby is leaking out gradually. That would also show you that okay, you're going into preterm labor. Another sign might be vaginal bleeding or spotting. Like I always say, never take any bleeding in pregnancy for granted. It can be a sign that there is a really serious complication going on. So preterm labor can also present with vaginal bleeding or spotting. Then if you are having any abdominal pain or cramping, any unusual, especially when it persists, like I said before in a previous podcast, when the abdominal pain persists, it's not going away, or you start to feel contractions, that the contractions are increasing in frequency, intensity, they are becoming more than 4 in an hour, then you should start getting worried that I might be in preterm labor, especially when you're not up to 13 weeks. I might be in labor. Rush to the hospital so that the situation can be salvaged immediately. Another sign that you might use to know when you're in labor is if there's increased pelvic pressure. Usually this happens when your baby's head has descended into the pelvis, so it's putting pressure on the organs there, and you're feeling more pressure in that area. This might be a sign that you're actually going into labor. So you should report this to your doctor as soon as possible. Low back pain is another sign that you might be in labor. Shouldn't take this for granted. You should report it to your doctor as soon as possible. So who are the people, or who are the women that are at risk of having preterm labor? If you've ever gone into labor before, this should actually make you to be more alert, because you are at a higher risk of going into preterm labor than women who have never actually had this happen to them. If you are carrying twins, triplets, quadruplets, or multiple pregnancies, people that are carrying multiple pregnancies are always at higher risk of preterm labor. If you smoke, you take alcohol or abuse drugs, this increases your risk of preterm labor. We all know smoking is bad for the baby, it's bad for the pregnancy. So is alcohol, and so is abusing recreational drugs. So please stay away from these when you are pregnant, when you are breastfeeding, and if possible throughout, even when you are not pregnant or anything like that, because it's not exactly good for your health. Getting pregnant within 6 months of giving birth. So those women that they don't know how to, do their family planning, do their child spacing or whatever, or take necessary precautions. If you get pregnant within 6 months of giving birth, short interpregnancy interval, you are actually at higher risk of preterm contractions. So you should be more alert for these signs so that you try to detect them on time, or you prevent them from happening. Then women that don't attend antenatal, this is why I always say, go for your antenatal classes. Because you're not a doctor, so you cannot treat yourself. You can't know if there's something wrong. You can't know what to look out for and all that. You understand? So women that don't go for antenatal classes, you are at higher risk of preterm labor. So make sure you go for your antenatal class if you don't want that to happen to you. And then lastly, pregnancies that usually result from fertility treatment. They are women that go to fertility treatment to get pregnant are always at higher risk of preterm birth. So now we know how to identify when you are in preterm labor, what can put you at risk. We know what it is. Now let's look at what are the serious health problems that the baby can have if you give birth to a preterm baby. So some of them include breathing problems. So the baby has problems breathing, difficulty breathing. Sometimes the baby will have to be on oxygen or will have to be on CPAP. They will keep the baby inside an incubator. Then preterm babies are usually at risk of brain hemorrhage. This is bleeding inside the brain. Infections, they're usually prone to having more infections. Their immune system is not well developed and all that. So they really, really have to be taken care of in sterile environments, appropriate precautions taken so that they don't catch infections from the environment or from other people. Then they're also prone to jaundice. I'll discuss this more in subsequent podcasts, but jaundice, yellowing of the eyes, the skin, mucous membranes and all that. They are also prone to jaundice. So if you have a preterm baby, always watch out for signs of jaundice. It's very important. And then lastly, they have trouble maintaining their body temperature. So their body temperature is always here and there, up and down. It's never really constant and all that. So these are some of the troubles that the babies can have and the doctors have to battle with. And usually preterm babies, they really need to be, they're delicate, they need to be cared for in an incubator, they need to be cared for by specialists in the intensive care unit, they have special feeding regimens and all that. But if you have a preterm baby, it doesn't mean your baby is not going to survive. It doesn't mean your baby will be abnormal. It just means that your baby needs special care, more attention and all that than someone or a baby that was born at term and everything. So just do your part to care for the baby, give the doctors all the support necessary, and try to detect any abnormal changes on time so that preterm labor doesn't happen in the first place, and everything will be fine. So I hope you've been able to learn one or two things. If you have questions, please drop them for me in the comment box. Feedback, suggestions, we would love to hear from you. Till then, have a lovely weekend ahead. See you or hear from you again next week, Thursday.